Me again. Um, and I will keep my comments brief. And I thank you again, Deb, for having this event. It was just about 2 weeks after my third birthday when my parents noticed that I was limping, and it seemed to not be in any pain. It took me to the pediatrician, and the pediatrician sort of kind of pushed it to the back of their mind as, she's a 3-year-old, she's imitating somebody, she's just playing, didn't seem to have any pain, and, call it a mother's instinct, call it persistence, call it whatever you want. And she said, no, I think something's wrong. And after an x-ray, after bone scans, what they found, they had never actually found in a child of 3 years up to that time, and that was a diagnosis of osteosarcoma. And osteosarcoma is a solid type of bone cancer, and it's most frequently found in teenagers and young adults when they're going through their growth spurts. We will never know why I was diagnosed with osteosarcoma. I was the first person in many, many generation lines to have had cancer. At the time, in 1982, when I was diagnosed, the treatment for osteosarcoma was chemotherapy followed by amputation. And you could have count on one hand the number of surgeons in the world that would perform a surgery that was called a limb-sparing surgery, which essentially you get your chemotherapy up front, shrinks the tumors, you do the surgery to cut out the bad part, but you leave the rest of the good part intact. And it just so happened that I was born down the street from one of those surgeons who took a chance. And so I had my rounds of chemotherapy, and I successfully completed my limb-sparing surgery. And so it was, just last August, 2012, when I used this same leg to help me complete my first triathlon relay in celebration of my 30 years from cancer diagnosis. And thank you. And as Deb said, it was the same leg that just about 2 weeks ago helped me walk across the stage to get my master's degree in nursing, which is also something I was, thank you, very proud of. And so, like many of you in the room, I have worn many hats when it has come to cancer. I've been a cancer patient. I am a very proud cancer survivor. The term doesn't bother me. Like, I know some people don't like the term survivor. It doesn't bother me. It doesn't define me. It is what I am. But I am a proud cancer survivor. I also sat by and watched my mother successfully be diagnosed and treated for breast cancer. As a nurse, I have watched some patients that were too young, no matter what their age, pass away from cancer. And now, in the past 10 years, I've been a provider for both adult and children undergoing treatment for cancer, and now have been given the incredible honor to start the survivorship program for NYU. And I think, in reflecting back in my time, I obviously was quite young when I went through my treatment and have the luxury of not remembering a lot of what I went through. But I'm obviously reminded on a daily basis of, the possible side effects that are long-term from, cancer. I sometimes, have this, I'm going to do something great today. Today I'm going to live my life to the fullest. And some days I'm just going to say this day stinks, and I'm going to lay on the couch and not have to think about it. And so I think, every day is different. The living life to the fullest and to the get busy living, I think we're all doing that. I think by showing up here to hear the inspiring stories, to be here to support yourself, your friend, your family member who has been diagnosed with cancer, I think it speaks volumes to, the life that we are living here. And, some of the things that really stick out, in my being a survivor now is the importance of being your own advocate. We can't be, somebody that sits back and waits for, the diagnosis or waits for our doctor to tell us what to do. And the perfect example that I have, which is what made me become aware of survivorship and survivorship issues, was my first job working with children with cancer. And one of the doctors looked at me and said, "Have you ever had an echocardiogram?" And I said, oh, come on, I'm 22 years old. I'm healthy. I know I have a drink every so often, but, I'm good. And she said, well, how about a bone density test? And I said, all right, now I don't know what you're talking about. And I had no idea that the treatment that I had received when I was 3 years old that could possibly set me up, long term for, diminished bone density and at risk for fractures. Possibly have some cardiac issues because I had a drug, doxorubicin, that could affect my heart many, many years down the line. And I thought, well, geez, I had no idea. We actually never went to an oncologist. I don't ever remember going to an oncologist in my teenage years. I always went back to my surgeon, and I think which is why I was always drawn very quickly to Deborah, because the moment that my family met my surgeon, not only him taking the chance on saving my leg, but for those of you in the room that are Christians, you understand the symbol of the fish, and he had a little fish pin on his tie. And he came right into the room and walked right up to me and shook my hand as a 3-year-old. And my parents remembered him very well from that and the interaction that he had with me. But so I didn't know what kind of follow-up that I needed, and not having, been around an oncologist, I didn't know I needed special tests. I didn't know I needed special scans. So I made my appointment with my primary care provider, and I said, I need a bone density test, and I need an echocardiogram, and I need you to order those for me. And she kind of looked at me like, well, oh, okay. And she did. And what we found is that I had some pretty significant, bone density loss. And I've actually, since when I have fallen, have fractured my leg, which is never a pleasure, especially when you're getting ready to start your first day as the nurse manager for the NYU Children's Cancer Center and you slip and fall and you break your leg. But these things happen, and these things are the things that you just have to move forward with. But again, the self-advocacy part, and I actually just want to read a quote from an article that I just found the other day that was published about self-advocacy. And it says, advocating for oneself was defined as an attitude, a duty, and something that evolves within an individual survivor as he or she realizes who he or she is and what he or she needs. And so I felt like that day when I found out that I needed this follow-up care, I never wanted another survivor to find out about their need for physical tests or what emotional support could be available or anything like that kind of haphazardly the way that I did. And so it has been my mission as a healthcare provider now to provide the education to people, the best that I can, or referrals, so that you yourself could be a self-advocate, knowing, having the education and being able to do that for yourself. So I thank you.